Good afternoon, everybody, and welcome to this special Lunch and Learn interview on our social media channels. My name is Jeff Brault, and I am pleased to be joined by Dr. Mitchell Cairo, the Chief of Pediatric Hematology, Oncology, and Stem Cell Transplantation, as well as the Director of the Childhood and Adolescent Cancer and Blood Disease Center at Maria Frere Children's Hospital here in Valhalla, New York. September is Childhood Cancer Awareness Month. It is also Sickle Cell Awareness Month, something that Dr. Cairo is very involved in. We'll get into all of that in a second. But first, sir, I want to thank you for your time. I know you're a very busy man and about to jet off to Europe. What are you doing across the pond?
So about every 3 years, I chair an international conference on childhood, adolescent, and young adult non-Hodgkin's lymphoma. And this is the 6th one that we've done since 2003. There'll be about 250 registrants from 41 countries represented and about 50 international faculty that'll be attending.
Well, best of luck over in Rotterdam in the Netherlands. As we mentioned with your title, you've clearly chosen to specialize in caring for very sick children in diseases that affect them. Why did you choose to make that your specialty?
That's a great question. Since the beginning of medical school, I had a passion for children. I also had a passion for my specialty in hematology, oncology, and transplant. And when I started, the prognosis was relatively dismal. Only about 20% of children with cancer were surviving at that time. We had very few cures. But through research and a lot of collaboration, both nationally and internationally, now we can boast the fact that over 85% of children are being cured with their cancer.
Something that I think sticks out when you talk about you and your team is the way that you balance the necessary bedside care and the interpersonal skills along with a very solid background in science and research. And I know in talking about it being Sickle Cell Month, you guys are working on a very impressive and potentially quite groundbreaking sickle cell trial. What can you tell us about the research you're doing in that respect?
Well, thank you. I do try to do a little bit of clinical, a little bit of research, a little bit of teaching, try to put it all together. In sickle cell, we came up with this idea about a decade ago that, you know, we can cure children with cancer by using bone marrow transplant and using alternative donors. And with sickle cell, it's a very debilitating disease associated with a lot of pain and very large amount of morbidity and very early mortality. And the only cure for sickle cell disease is a bone marrow transplant. But unfortunately, the typical way we do a transplant is to use a brother or sister in the family who happens to be a tissue match with the patient who has sickle cell. But in sickle cell, because a lot of the brothers and sisters also have sickle cell, they are not donors. So really there's only about 15% of children who would be eligible to get a transplant through the traditional route. So about a decade ago, we came up with the idea that maybe we can use the mother or the father as the donor, who would only be half matched to the patient. So the child gets half the genes from the mom and half from the dad. And we came up a way using our cellular and tissue engineering laboratory that we opened here at Westchester Medical Center of collecting the cells from the donor, the mother or the father, and engineering that set of cells so that we basically give the good cells and we sort of leave the not so good cells out. And by doing this, we now open up the opportunity that almost any child could be cured from transplant. And now we lead this 10-center trial. We're now into our 2nd trial. And we can boast that over 90% of children have been completely cured of sickle cell disease.
Well, obviously exceptional results there. This is, to get something like this to the point that it is now and then even further into the point where it becomes accepted science is a really difficult process. Where are you at in that process and how much further is there to go?
Well, like you've heard before, it takes a village to be successful. We have a fantastic village here at the Maria Frere Children's Hospital. So it involves the CTEL lab, as I mentioned, involves our clinical research team, involves the nurses, the clinicians, all the things that have to go into doing this. So we're now into the 2nd study, and we think if the 2nd study is as compelling and successful as the first, we think that this actually will become standard of care.
Well, best of luck to you in finishing that important work. That's just one component, of course, of the comprehensive program that you and your team oversee. Tell me about the other facets of what's available here in the Children's Hospital.
Yeah, so we offer personalized medicine, including breakthrough therapies, and it's based on scientific research. So Our program is geared to giving each child their own individual therapy that best fits them, with the idea of maximizing the cure and minimizing the side effects and the long-term effects. And so we have what we call many targeted therapy programs, where we're trying to target the cancer cell and have as minimal off-target effects on all the other normal cells, so the child and the family go through a more humane type of treatment and then have a lot less morbidity and certainly a lot less long-term effects in the future.
I'm curious about how you and your team strike the balance between obviously being, dynamic researchers and on the cutting edge of these therapies, but then also just dealing with the emotional component of your working with scared children and scared families, and how those things blend together in the care that you give.
That's always a very good question, and everybody kind of approaches it a little bit differently. So what we try to do is have a very multidisciplinary complementary program, where not only are the caregivers involved, but a lot of other allied healthcare professionals, such as psychologists, social workers, nutrition, child life, so that we're all working as a team together. So it could be Team Smith or Team Jones, etc. But the question you raise about the emotional sort of experiences that we have, they are difficult at times, but they're also very inspiring, and they kind of drive us to want to find the next cure and to try to minimize the effects from other therapies. So it is a little bit of an extra burden, if you will, that we take on, but it also is a positive in that it incites us to want to do better the next time around.
We're speaking here in September in Childhood Cancer Awareness Month. How is cancer in children different from cancer in the general adult population?
Another great question. So probably about 75% of the cancers that occur in children don't occur in adults. Some of the leukemias and a few of the lymphomas, there's definitely overlap, but there are many specific cancers that only occur in children that don't occur in adults. And therefore, the funding and the type of programs that one has to develop for childhood cancer are drastically different in large part than they are for adult cancer.
We've touched a lot on the research that happens here at Maria Frey Children's Hospital. What's coming next in terms of the work that you're doing to try and prevent or treat as many childhood cancers as you possibly can?
That's a great question. So right now, through the use of the cellular and tissue engineering lab we talked about, we're developing protocols that we hope to roll out next year, where we'll actually give cell therapy that will be directed either against a childhood cancer or maybe a childhood infection that they get. So that specific kind of targeted therapy through cell therapy is probably another area. A second area that we're looking at is, again, in a personalized medicine, is trying to map down exactly what the abnormal gene is, what might be the abnormal pathway that's going on that triggered the cancer or is making the cancer resistant. By understanding that, then we can tailor make their therapy so we're affecting the specific mutation, gene abnormality, abnormal pathway that the cancer cell is doing. And the third is trying to really understand why some children respond to cancer therapy and why some don't. And we're more and more learning what are the resistant factors that cause them to be resistant, why one patient responded and one didn't. So it's methods of circumventing resistance to cancer.
Certainly still a lot of work to be done, but I do think it's important to note just how far this field has come in a relatively short amount of time. Outcomes in this area get better and better every single day. Just over the course of your career, what kind of progress have you seen in just the field of trying to treat childhood cancer?
Yeah, so as I said earlier, when I started out, unfortunately, about 4 or 5 children that I took care of back in the day, I won't admit when that day was, but it was a while ago, didn't make it. And so now, as I said, almost less than 1 in 10 or 2 in 10 are not responding. And so that's been a slow but incremental increase over the last 35 or 40 years. And a lot of that is due to team science, it's due to research, it's due to patient participation in families into clinical trials, new discovery, more science. And so it's been a great run, great experience. may not ever happen again, and I've had a really golden opportunity to be involved in that pathway all along.
As you think to maybe a utopian future where we can rid ourselves of childhood cancer on this planet, what reasons for optimism do you have that we're going to continue to make steps in that direction? If we never get there, we're going to progress. What reasons might you have to think that that good things are still coming?
Well, there are more good things coming because the science continues to exponentially increase. So I think particularly in the areas of genomics and immunology, those particular areas, we've learned so much about the regulation of cancer, how they develop, why they persist. I think as we continue to make progress in particularly those two areas, we'll understand more about preventative areas that we can look into and how we can actually never have the cancer develop in the beginning.
And before we let you go, I know that it's very important to make it known, you touched on some of these folks earlier, that it's certainly not just you. It's a very deep and diverse roster of people that are working on these complex cases here at Maria Freire Children's Hospital. Just tell a little bit about the importance of the team around you and how you guys strive in everything you do to make sure that you're doing things the right way.
Yeah, so that's great. So we actually abide by all the right way. We don't get into conflicts with outside agencies or pharma. We do everything pretty much by the book, if not by the book. So in the Children, Adolescent, and Cancer and Blood Disease Center, we have over 75 people, and we have a large quality program. All of our protocols are approved internally by the Institutional Review Board. We obtain the proper approvals from FDA, et cetera. But it's a multidisciplinary, talented group of people. I'm so proud to be part of the group. And without really the village, we wouldn't be anywhere close to being as successful as we are today, and we're very successful.
Dr. Mitchell Cairo, the Chief of Pediatric Hematology, Oncology, and Stem Cell Transplantation, as well as the Director of the Childhood and Adolescent Cancer and Blood Disease Center at Maria Freire Children's Hospital, is our guest here for this Lunch and Learn interview. Thank you so much for your time, sir.
Thank you. It's been a pleasure.
You can learn more about the program by going to mariafreirechildrens.org. Click on Hematology and Oncology. See the little button right in the middle of your home page there. My name's Jeff Brault, and I thank you so much for joining us for this Lunch and Learn interview on our social media channels. We hope to see you next time.